Hey guys, Dr. Ben here at the Functional Medicine Centers. I'm so excited today to go over a topic that just is so prevalent in today's society. Do we mask? Do we not mask? Is it helpful? Is it not helpful? Does it actually cause problems? So today I want to go over a bunch of information there. So for those of you I've not met in person, I'm Dr. Ben Galliard. I work here in Fort Collins, Colorado at the Functional Medicine Center. We have a satellite office in Phoenix, Arizona as well. Dr. Shanice Wright, great doc down there as well. So we work with patients of all different types of issues: autoimmune, diabetes, inflammation, digestion, all types of different things. So I love getting the information out there, things that I discover, and information that is really prevalent and is confusing for a lot of people. And so if you have any questions at all, go ahead and type those down below. I'll be taking a look at those. Go ahead and also put in where you're calling in from and where you're watching from. And I love to see where everybody's at, and it's fun for everybody to be able to tell. We've had Maryland, we've had Arizona, California, all types of different things. So today we're going to go over: should you mask? Should you not mask? Is it helpful? Is it not helpful? There's a lot of different information out there, a lot of different studies, research, all types of different things. And I want to go over first some of the different types of masks. So there's different masks that you can be using. There's N95, there's surgical masks, there's cloth masks, different things like that. So one of the first things that we look at is the N95. N95 is going to be the true 95% of the particles are not going to get in. That's one that's got the little respirator on there, and that's reserved really for medical professionals. Those you must be trained and passed a fit test. So a lot of you don't realize that you're grabbing N95 at Home Depot or whatever it is, but you have to pass a fit test. So they actually hook up to that respirator on there, and they actually make sure that it is sealed and you're not getting anything in. Hey Anna, good to see you out in Grand Island. You think we're going to have some Husker football this year? I hope so. So the N95, if you're using an N95 mask and really want to get the benefit out of it, you need to know how to fit it and have it properly fitted, meaning it has to seal appropriately. So the problem with all masks, unless it's truly sealed like this, is that those germs are going to get in, and they're going to come in. I'll see people, literally at Costco, he had 2 rubber bands and a washcloth like this and just holding down, and it's like, okay, like germs aren't going to get in and different things. Hey Dave, hope you're doing well. Hey Jesse, Phoenix, hope it's not getting too hot yet there. Heard that heat wave's coming. It's going to warm up this weekend, it looks like. So N95 mask really needs to be fitted and needs to seal very, very well to get that 95% of germs that are going to keep it from getting in. Hey Catherine, North Central Iowa, great to see you. We used to go up to my grandparents up at Lake Okoboji for years and years and years. It was a beautiful, beautiful place. So N95, they're intended to be disposable, although they're trying to figure out how to make those so they're actually able to be reused. So can you sanitize them, some different things, because they're pretty hard to get right now. And what we're seeing on the open market, $2-3 a piece. If you're going through 1 or 2 of those a day, it gets pretty pricey through there. So the next level down is what they call the surgical masks, and those are they're like long and wide, usually blue, and almost this perforated type of thing where it's set up like this, and you can spread it open. There's usually one metal piece on the top. And so they're going to be able to lock down a little bit, but really not do that. Hey, Lindsay, I've seen welding helmets and all kinds of ridiculousness. I'll be honest, I did wear a stormtrooper helmet at one point, but it was kind of funny. It was at the grocery store. Not a single person looked at me. Nobody acknowledged it, said anything. They just kind of assumed that that's what you do. So, So the surgical mask is that blue strip, and this one, it's going to be a lot less effective than the N95 if the N95 is used appropriately, and it's going to filter some things out. It's, again, loose-fitting disposable mask that protects the nose and mouth from there, especially from droplets, sprays, some things like that. Yeah, Lindsay, I would have loved to see you there because you would have at least smiled or waved or something, but nobody else even acknowledged me. Hey, Catherine, thank you for watching. We love having people on. Okay, so surgical mask may protect others from reducing exposure to the saliva and respiratory secretions of the mask wearer. So it kind of goes both ways with the surgical mask. They're not perfect. They're not great. They're going to protect you. If you're sneezing and coughing and those things, it's going to keep that from coming out. I'll be honest, I have to wear one at work here, and I have sneezed into it multiple times. If I'm wearing it, my nose usually starts running, or I'll sneeze once or twice a day. And so I'll sneeze it, and then I was like, what do you do? Do you take it off and then sneeze into your arm? That's kind of gross. And if you're sitting with somebody, or do you leave it on, sneeze into it? And so if that happens, then I throw it away, but then it's a big mess. Hey Randy, hope you're doing well out there. Asthmatic, and I have a hard time wearing one. I get hypoxic. Absolutely. We're going to touch that on in a few minutes here of what actually happens when we wear a mask a lot and all the time, and what we're seeing through here. So the surgical mask, the FDA has not approved any type of surgical mask for protection against COVID-19. So, but they provide some protection when N95 masks are not available. So if somebody's in a medical setting, if somebody's a massage therapist, if you're getting exposed, or they think they might have some issues and be spreading those germs, then the surgical mask is going to be a good place to go. But again, it's really for that person that's worried, oh my gosh, I don't want to get exposed. I had a patient, she was a medic in the military back when they had a bunch of MERS cases, Middle East Respiratory Syndrome. There's SARS, MERS, a bunch of these different viruses like we have going on now with the COVID. And what she thought was interesting at the time is that the patient didn't wear a mask at all, even though they were the ones sick and spreading the germs. Anybody that wanted to not get infected, the nurses, doctors, medics, everybody, they're the ones that wore the mask, gloves, anything like that. So again, it doesn't have to be an everybody wears a mask thing to protect those in need. And so that's why they're loosening a lot of the restrictions now. And again, a big part of why they said you need to wear a mask originally was because there was a woman from China in Germany that they found, I think it was back in the first part of March, and they said that she was asymptomatic and was spreading these germs. And that's the main study that they went off of to say that, oh, COVID-19 asymptomatic people can spread germs. Traditionally, asymptomatic people are not going to spread viruses very well. That's just not a very common thing. That's why originally they said, don't wear masks, save the mask. Even he was the chief medical doctor with the Trump administration, and said, stop wearing masks, everybody, leave them for the medical people. So what they found was that viruses are still going to be transmitted. The viruses can go through almost all fabric, all material, and so at that point it was hey, don't even worry about wearing masks. And that's why for 2 months all of our people at Lowe's and Home Depot and all these different things. Hey Jeremy, hope you're doing well out there. How's the weather? Good to see you. So what we look at is that at first those masks were not recommended because most viruses can transmit through, even N95s could still have some germs go through there. So we've got the different levels. The N95 is going to, in theory, take out 95% of the germs that are coming in. But again, you've got to have that fitted correctly. So you need to know professionally, basically, how to seal that and how to make sure that no other air is coming in around there for those to be effective. Jennifer, reduce your viral load. So important. Even more important than reducing your viral load, Jennifer, is going to be to build up your terrain. Even Louis Pasteur, at the end of his life, who developed pasteurization and everything, said it's not about the bug, it's about the terrain. And so hopefully we're able to build our immune system there. So I'm not seeing a loosening of restrictions. We went to the wild outside and on the bridge. In Larimer County here, Elena is saying that we're not seeing loosening of restrictions. In Larimer County, they have said when you're outside in different places, you don't have to wear masks. And so people working, I've got a patient that they plant a whole bunch of flowers and all types of things, and they were all having to wear masks outside, and all the women were breaking out underneath that mask. And that's a really important part of what we look at with the mask. And one of the problems with rebreathing that air, I had a patient yesterday, she said by the end of the day it's like soaked, it's wet from all that moisture. And what we look at is that is going to breed bacteria. It's going to hold in bugs. It's going to cause problems with our sinuses, with our throat. We're going to be rebreathing those germs over and over. And if they're breaking out on the skin, what's it doing inside of our nasal passage and mouth and everything else? So long-term use of the widespread population of masks is not healthy. There's actually a lot of detrimental effects from it. In certain instances, certain places, if you're going to see grandma at the nursing home, some things like that, absolutely you want to be very careful and use your precautions. But ultimately, long-term use can have a lot of negative side effects there. So, hey Denise, hope you're doing well. Yeah, because the valve, interesting, the N95 mask, you can, droplets can actually come out of there. I haven't tried that specifically to feel what actually can come out, but it would make sense because again, in the hospital settings, they don't make patients wear masks. It's the doctors and nurses and everybody else that wears it. So whatever gets on the patient, they're already sick to begin with. So, yeah, Jennifer, don't agree with the mask outside as long as social distancing can be maintained. Absolutely. I've had patients that they've gotten yelled at for running, for biking, things like that without a mask. And it's kind of like the governor in North Dakota, he said, please guys, do not shame each other. Whether you're wearing a mask, not wearing a mask, do not shame each other. There's specific reasons why people are doing what they're doing. And ultimately, if somebody's very worried and doesn't want to get infected, then wear a mask and do what you've got to do. Get an N95, be as protective as you can. But for those of you that are out running and biking and hiking and all those things, it truly health-wise can be detrimental to that. So, hey Stephen, how are you doing, bud? Yes, it's time to stop the ridiculousness. Well, you're not wearing anything. So, again, I encourage people to be sympathetic for others. And if somebody truly is worried, because who's going to get sick here? Remember, it's the older people. The average age in Italy of people that passed away was 80. In Massachusetts, it's been 81. And what are those cofactors? In Italy, 99% of the people were either overweight or obese. They had diabetes, they had cardiovascular disease, and they had high blood pressure. In New York City, they looked at the critically ill over the last month, and they found that 63% were Hispanics, 67% were men, and over half were overweight or obese. And I think it wasn't even overweight, it was just obese. They had diabetes, they had high blood pressure. 27% of the people that they've documented in the United States that have passed away have been African American, and most of those were obese. So we know that if you've got one of these comorbidity factors, being obese, overweight, high blood pressure, diabetes, if you're over 70, 80 years old and in ill health, you've got to be careful. But if you're not, then the mask can actually be a problem. Yeah, Lindsay, low vitamin D, huge part of it. We've got to get that balanced out there. So Jennifer, we lost a 27 and 34-year-old in Nebraska in the same day on vents. So again, we've seen this all the time. People say, whether that's in the media or whatever, is that healthy 27-year-old or 34-year-old, anything like that. But what we don't know is, are they truly healthy? I've looked at plenty of blood work from people that are 27, 34, 9 years old. I've seen insulin resistance and pre-diabetic and these inflammatory processes. There was a study just came out last week looking at interleukin-6 and D-dimer. I won't quiz you on those, but those two inflammatory markers were found in almost every single COVID patient. So if somebody's got this predisposition for this inflammatory process, then absolutely it's going to lead to worse outcomes. So a big part of that is going to be that insulin resistance. Again, the surgical masks, not perfect. The FDA has not approved them as a protection against COVID-19 virus, but it's better than nothing. Again, the N95, you've got to be able to get that fitted correctly if you truly want to get that. Yep, Jesse, I agree. It's about choice and respecting other people. And some people, you may have warned them, some people were not. But it really is about that individual. What do you want to do and to protect yourself or other people? But hey, Veronica, hope you're doing well down there in Atlanta. How are the horses doing? Yeah, so again, and Edith, there you were wearing yours so other people feel better, and so maybe so you can go in and hug people, some things like that. Okay, then we get to cloth masks, and this is the really important part because probably 99% of the people out there are not doing N95. They're not doing the surgical mask. They've made their own mask. They bought their own mask. Grandma made them a mask. Somebody made them a mask. So they say they should be worn in public settings where social distancing measures are difficult to maintain, such as grocery stores, especially in areas of significant community-based transmission. So again, they're kind of saying, and this is from the FDA and the CDC both. So if you're in an area where there's a pretty high population of infection, then you definitely want to wear those. And if it's a law in your community and you can't go to the store or things like that, then obviously you got to do what you got to do. But they say if you can't maintain your social distance, and especially if it's going to be in a area where there's a significant transmission of that infection. So here's a few pointers putting on and taking off a cloth mask, because it's not just as easy as grabbing that mask and pulling it off. So you want to place your mask over your mouth and nose. Okay, well, that sounds simple, right? But guess what? You go to the store and how many people are like this? It's about the silliest thing you've ever seen, is that their nose is sitting out, right? If you're gonna wear a mask, you gotta at least cover your mouth and nose. Otherwise, you might as well not even be wearing it. If you sneeze, if you breathe out through your nose, molecule, whatever's gonna be coming out through there anyway. So you wanna cover your mouth and nose. You want to make sure it's snug. But the problem here is that people that are wearing these all day, they're getting headaches. They're getting a lot of issues that we're seeing with people straining on their ears, pulling in, some things like that. So they say you've got to make that tight, but ultimately it's not going to be able to help people as well, because it will, if it's not tight, then you're not going to cover it, but you will be causing some headaches and things like that. Don't touch your mask while wearing it. This is one of the biggest problems with wearing a mask, is that people jack with it all the time. I find that even with the surgical mask, it'll slide down a little bit, it'll be up too high, it'll be sucking into my mouth and I have to pull it out. A lot of different things. It's very challenging not to touch your mask, but they say don't touch your mask. If you accidentally touch your mask, you got to wash and sanitize your hands, because those germs could have got on there. So okay, then you fiddle with it. Then you're supposed to get up and go wash your hands and go from there. So hey, if you guys haven't put down already where you're watching from, go ahead and put that down below. If you haven't liked or followed our Facebook page, go ahead and do that, and then hit the button for the updates, where we'll tell you when we go live in there as well. Okay, so you want to remove the mask by untying it or lifting it around the ears. Do not grab it again. They say don't touch that front part. Wash your hands immediately after removing your mask, and then regularly wash your mask with soap and water in the washing machine. It's fine to launder it with other clothes. So this is a really important part. Hey, Cody out in Virginia, how you doing there? So this is a really important part, is that so many people are wearing the same mask over and over and over. Hey, Brenda, how you doing in Blair there? Randy, Scotts Bluff. Yeah, I would love to get out hike the monument there. So the masks, they need to be washed at least every day. If you're wearing it 8 hours a day, you need to have 2 or 3 masks with you. You need to have those and be able to use them. Yes, but you have to wash them. Otherwise, you're reinfecting yourself over and over and over. So you've got to be able to wash those on a regular basis. So Azar, he's the head of the Health and Human Services, he said wearing masks could actually sometimes be more harmful to you from not wearing a mask, because if it's not fitted right, you're going to fumble with it, you're going to be touching your face, which is the #1 way you're going to get disease. is unclean hands touching your face. So this is the head of the Health and Human Services with the federal government. He said sometimes it can actually be worse. So you can't be fiddling with your mask. If you're going to wear it and truly be getting anything out of it, you can't be touching that mask. But they said basic public health hygiene, washing hands, extended time for soap and water, not touching your face, coughing into your elbow. Those are the best things for flu season, for common cold, for novel coronavirus that any of us can do for preparedness. And this is from the Health and Human Services. So again, wash your hands, soap and water, not touching your face, coughing into your elbow. Those are the things that are going to be better even than wearing a mask. And then there was a study that was published in Australia, and they found that masks were 80% effective in protecting against influenza-like illness when worn consistently, but there was the catch. The researchers noted that compliance with mask use was less than 50%, meaning either they let it come down or they would take it off incorrectly, meaning more than half the people in the study did not actually keep wearing them as directed. So again, if somebody's going to wear a mask all the time, 100% of the time, sure, there's going to be benefit, but there's a lot of negative that comes from that as well. And we look at this as you're decreasing your oxygen use, you're decreasing a lot of health, you're rebreathing those bacteria and infections and some different things like that. Hey, Misty, how you doing out there in Alliance? The Bulldogs, huh? So big thing we're looking at, if you're going to wear a mask, wear it correctly. If you're going to wear a mask, make sure it's kept clean over and over and over. You've got to be washing it. They cough in their elbow and then they do the elbow bump, right? Lindsay, absolutely. Whole health needs to be considered always. We've got to ultimately get the body healthy. Way more effective than wearing a mask. If you're healthy, if your body's vibrant, if you've got the power within inside of you to fight this off, it's going to be way more effective than any mask, any washing your hands, any kill off, anything you can possibly do. We've got to be able to get your body as healthy as possible, and that's the functional medicine approach. So hope you learned a little bit today on the mask issue. And again, don't shame people. Wear them if you're worried about it. If you're not, and it's not a law, I would say don't wear it because it's going to actually cause more problems. But if it is the law and you got to do what you got to do in your area, do what you can do there. So everybody, make it a great day, and we'll talk soon. Let me know if you have any other questions.